In this question, you have to identify the occupational respiratory disorder. Option A, anthracis. It is incorrect because anthracis refers to Bacillus anthracis, the bacterium that causes anthrax, an infection that can affect the lungs, the skin, and the digestive system. But it is not specifically related to occupational respiratory disorders. Option B, silicosis. Now, silicosis is an occupational respiratory disorder which is caused by the inhalation of the silica dust, often occurring in workers involved in mining and construction works. And continuous exposure to silica dust damages lung tissues, leading to inflammation, fibrosis, and scarring. Thus, it is the correct option. Option C, emphysema. It is also incorrect because emphysema is the chronic respiratory condition when the alveoli in the lungs are damaged, leading to difficulty in breathing. And it is commonly associated with smoking rather than occupational exposure to specific dust or particles. Option D, botulism. It is also incorrect. Botulism is an illness caused by Clostridium botulinum toxin, usually due to food contamination.